You had asked me about, and I think it's important, why people lose their hair. And, we talked a little bit about female hair loss and different tests you can do to rule out, different diseases, including thyroid and so on. But, and I mentioned that in men, it's usually an issue of androgenetic alopecia. So it's really familial. It's genetic. It's
Hmm.
coming from one of your parents or both of your parents. And the root of that is DHT. The
Hmm.
culprit is dihydrotestosterone. So we have testosterone that gets converted to this dihydrotestosterone. And this DHT then attacks hairs that are adult hairs and causes what we call miniaturization. So it causes them to become shorter, finer, loose pigment, and they become villous hairs. So when someone sees that, they're feeling their scalp and they see that the hair is very fine compared to other hair behind in the donor or on the side of the head, that is miniaturization. These villous hairs are being attacked by DHT. And our goal is then not only a hair transplant, and I think this is important. A lot of these offices that people go into have salespeople if they're not
Hmm.
talking to doctors. And some of the doctors even focus on hair restoration. They focus on, let's do a transplant. I think that that's only 50% of the discussion.
Hmm.
When a patient comes in and is losing hair, not only do we want to talk about hair transplants and what we can do for them, but I think before even getting to that, we want to talk about how do we stop your hair loss?
Hmm.
What do we do to prevent you from losing more hair? Because if you're a young guy or an older guy that's losing hair, and I do a hair transplant, you're going to be happy for a couple of years. But if you continue producing DHT and causing miniaturization and losing more hair, then what's going to happen? You're going to be losing all the hair around what we put in.
Hmm.
You don't lose the hair that we put in because it's not sensitive to DHT, right?
Hmm.
So in order to prevent that, we have to talk about what can we do for prevention. Well, prevention, there are only really four things that are FDA approved for prevention. Actually, only three of those four things are FDA approved for hair. But all these things that you see on the internet to grow hair and rosemary oil and all of that, I mean, I'm not against people using that if they really believe it can work, but there's no studies that show that this stuff works. Things that have been studied and are known to work are minoxidil. And minoxidil, today, we not only do the lotion on the scalp, we also do pills in low dose minoxidil. Finasteride, or what it's called by Merck as Propecia, and finasteride are the same thing, finasteride being the chemical name, which is a great drug, works really fantastic. 90% of people on that medication stop losing their hair. But their problem with finasteride is that about 3 or 4% of people have a decrease in sex drive, decrease in their ejaculate. If that happens, they stop the finasteride and everything goes back to normal. Of course, on the internet, you will see people talking all kinds of stuff about finasteride, that its rate of sexual side effects is much higher than what it really is. I have a lot of patients on finasteride, and most of them are doing well. When they do have a side effect, we take them off, everything comes back. Uh, PRP, plasma rich protein, also important, used for many years by plastic surgeons, rather orthopedic surgeons, in athletes that get hurt. Okay, this is your own supply. This is your own blood, which we take blood from you. We put it through a centrifuge. We separate the blood cells from the platelets and the serum and the hormones, and then we take that portion of it and we re-inject it back into your scalp. And it's worked very well. And also laser therapy, laser caps that are getting better and better all the time. You use it 10 10 minutes a day, 7 minutes a day, depending on the laser cap, and also increases blood flow to your scalp. These are things that can be done simply, and they work in helping you to maintain the hair that you have. So we need to talk about that as well
Of
as
course, of course.
as well as the surgical aspect.